Hello everyone, today we are going to talk about obesity. Obesity is the lipid deposition caused by the imbalance between energy intake and consumption caused by a variety of factors. High-fat diet-induced obesity is a risk factor for many metabolic disorders including cardiovascular diseases, diabetes, and fatty liver disease. At present, the treatment of obesity is mainly lifestyle intervention, drug weight loss, and weight loss surgery, but the curative effect is limited and the side effects are serious. Oriental herbal medicine has shown powerful capacity of improving both obesity and its metabolic diseases through the regulation of gut microbiota. In this video, we will talk about obesity, its causes, and health complications in addition to the role of Oriental medicine in treatment. Our role today is to answer most of your questions regarding obesity. Today we have Dr. Raymond, who is a leading doctor at Jaseng Hospital of Korean medicine. He's going to discuss with us everything about obesity from an experienced medical point of view. I'm Ume. Before we start, please subscribe to our channel so that next time you'll be updated with our new releases. Good afternoon, Dr. Royer.
Good afternoon. Nice to be here.
I came here with some frequently asked questions. I have a lot of questions, so going straight to the subject. We're talking about obesity, right?
Obesity.
Yeah.
Very interesting object.
Okay. So what is the difference between obesity and then overweight and then morbid obesity?
Yeah, I mean, obesity, or let's start with overweight. Usually how we measure the obesity or weight ratio with height is the so-called BMI. The body mass index, and it basically divides the height of the person through his mass, and by this we get a number like something between 20-40 could be, and we say a normal level of weight related to the height is if you have an index of, let's say, up to 25. Yeah, so from 25 up to 30, we call it overweight. Yeah, and then when it goes over 30 up to 40, it's obesity. Yeah, and over 40, then it's morbid. Serious morbid obesity.
But usually for the weight, for example, for a BMI, there's also the weight of bones and the weight of water retention, and all of these, they cannot really be measured when using BMI. So how do you make a difference?
How we do makes a difference. Of course, BMI is not an absolute kind of measurement. Yes. It's just a guideline. Let's call it a guideline. It's a rough guideline. It helps to understand how good or bad basically we are. Of course, there are some related issues like the different body tissues. As you said, muscle. Muscle is a huge portion of our mass, of our weight. So the muscle is very important. Muscle ratio to fat ratio is also very important. So there are different other measurements that can differentiate between how much muscle we have, how much fat we have in our body, and even bones. So there are different measurements, but the very basic and common, let's say, differentiation regarding the diagnosis of obesity, that's the BMI.
All right. So what are some leading causes of obesity?
There are a lot of causes. The most obvious cause is eating too much and doing too little exercise, physical activity. So that's the biggest issue, and especially the modern people, they don't need to move anymore as much. Most of the people sit in front of computers all day long, so no movement there. So we are moving actually less, and at the same time we're eating more because there's plenty of food out there. And also there's plenty of, as we call it, processed food. And those kind of processed food, they contain a lot of, let's call it hidden, like carbs, salt, sugar, saturated fat. So those kind of, let's say, lifestyle conditions, eating and not exercising is the biggest factor. Then, of course, there are other factors like genetic. So if there is obesity in the family, of course, there's a higher chance for also getting obese, even though the patient doesn't need to eat too much, but still it's much more easy to gain weight.
So in that case, in the case of if there is a history of obesity in the family, how much the percentage roughly, that the person will also be obese?
I mean, of course, still it's not 100%, yeah, because even if the most of the family have obesity, but there are still cases in the family which looks completely different, very slim. Yeah. So, but I would say at least 30% or 50%, I would say there is a chance that with same kind of amount of eating, he would gain more weight than other person without the genes that make you prone to obesity. But besides of the genes are of course some diseases, medical conditions, which also could lead to overweight and obesity. For instance, if the thyroid don't work well, so hypothyroidism.
So in the case of obesity, what are the treatments that can be used?
The treatments
non-surgical treatments
for obesity.
For obesity.
From our perspective, so we are a traditional Korean hospital.
Yes.
So we are trying to treat the patients in a traditional way, and for obesity or overweight, there are very good medications. We mostly rely on medications, herbal medications. Those herbal medications, they consist of a variety of different herbs. Some of the herbs, they stimulate the metabolism in the body. So basically what it does, you feel more energy. But at the same, and by this also the body kind of consumes more energy from the body. So it's very easy to go into the fat tissue, also consume those tissues. So that is one target from our side for the obesity patients. And the second is the medicine also helps to reduce the appetite.
Okay.
So then patients feel less hungry. At the same time, the body consumes more energy. The metabolism is increased. The organs function better, stronger. So it's, I would say, a very effective way and a very safe way to lose weight, because usually we don't see real side effects.
All right. So why is it so? Is it because that medication, it contains certain substance that make you feel full?
It contains, we call it herbs. Herbs. It's not just a chemical substance. Yes. It's always herbs or different herbs mixed together and boiled and made like a tea. So that's what we use. Usually it's in tea form. And this herbal tea or some of those herbs, it's very difficult to explain it in a chemical way.
All right.
Because for instance, every herb has a chemical or from 50 to 200 different chemical compounds, which could be active in a system. So we don't know exactly what kind of chemical compounds do what in your system, even from one herb.
So it's very complex.
But it's very complex. But there is a long history of experience using these herbs, and we know how each herb works. What does it do in your body? So we can combine the different herbs regarding the body's constitution or the body's condition. Yes. So we address. So basically, our medications, when I prescribe the medication, is usually almost different for everybody. It's not like one medication for everybody, like the Western medicine usually prescribes. For us, is for the condition of this patient, we prescribe a combination of herbs which is most suitable for his or her condition.
So talking about medication, is there any side effects to this medication, or are there some patients who cannot take this medication?
I would say from my experience, side effects are almost not there, just because it gives you energy. It's a little bit similar, you can imagine, when you drink coffee, even though there's no caffeine in the medicine, but there are some herbs which also have a kind of stimulation effect. And some people are very sensitive when they drink coffee. So some people, when they drink coffee in the afternoon, they cannot sleep because of this energy. And sometimes very sensitive patients might have also a little bit difficulties because of the energy they feel, that they have a little bit problem of sleeping. So that's usually the more or less only side effect that we see. But in those cases, usually when they adjust the amount of medicine to their needs, when they reduce the dose, then it's fine.
All right. So apart from medication, are there any surgical interventions to treat obesity?
Yes, there are surgical interventions from the Western medicine, usually for very severe cases of obesity. For severe cases of obesity, they would do some surgery, like implement kind of band into the stomach.
It's like a ring, right?
It's like a ring, yeah. Or they do a bypass surgery, so that only a little amount of food going into the stomach or into the digestive tract. Yeah? So it kind of reduces the size of the stomach or so. So that's the most common approach of surgical intervention.
Right. Yeah. So my next question is very often asked by women. So does obesity affect in any way fertility?
Oh yeah, it can. Because especially when it comes to pregnancy, we know there are studies there which states that with obesity, the chance that abortion is higher.
Higher,
yeah. So that is an issue which has to be considered. Also, there are many more complications with delivery with obesity.
Okay.
Yeah. So that's the main issue. Of course, if there is too much fat in the abdomen, in the lower abdomen, of course, the function of the uterus, ovaries, because everything is in fat, you know what I mean? So blood supply itself is also a bit reduced.
Okay, so it's like under stress.
It's kind of under stress, yeah. And even though there is a lot of tissue around, but the blood supply, which is very essential for the growth of the baby, might be even reduced because the other tissues need so much blood. So that could be also an issue.
So just like pregnancy, are there any health issues related with obesity?
Yeah. There is, for instance, when you develop obesity, you might have like diabetes or high blood pressure for sure. The blood pressure usually goes up because more body mass has to be supplied with blood. So the heart has to pump more, the blood pressure goes up. Also the cholesterol level goes up. So there are a lot of different problems coming from cardiovascular disease. Even cancer is often related to obesity. Yeah? So there are many conditions that can be the result of obesity.
So for obesity, for obese people, the first solution they think about is diet. But most of them, they tend to fail it. Why is it so?
That's a good question. I would say for most people, it's difficult to turn the switch in their thinking, in their attitude and willpower. Let's call it willpower. Because I have seen many patients, and those who really, because of whatever reason, some want to lose weight because of beauty, some want to lose weight because of health issues. And the clearer the purpose is, the higher the chance of success. But if they only say, okay, I think that the doctors told me I should lose some weight because it's not healthy, but I don't have any problems, those patients usually they fail, even though they lose some weight, but they are not really able to change their lifestyle. So they just expect that somebody will do it for them, including taking some medicine, and the medicine will fix everything. And that's not the case, especially with overweight and obesity. The efforts are the main part, the efforts of the patients. And so they need a clear target, the willpower to continue. And then if they do so, usually they also succeed in losing weight and maintaining the weight. Because losing weight is one thing, maintaining the weight. Often people also tend to start a very rough diet program, starving and,
starvation mode.
And all this kind. There are so many different diets you can nowadays try, but they are quite rough. It's very difficult to continue as a lifestyle, those
Yes.
kind of treatment. So it's for a short period of time. Yeah, but as soon as they say, okay, now I lost some weight, it's enough. So they go back to their old habits. And as soon as they go back to their old habits, it's back again.
People are usually looking for the fastest way to lose weight.
That's the problem.
And that never works.
Yeah, that never works. Yeah. Weight loss takes time. Yeah, and from my experience, depends, of course, how much weight you want to lose. Yeah? But even if you want to lose just a few kilograms, yeah, the least period of time you take as a target is 3 months. Under 3 months, you will fail.
Yeah.
Why 3 months? Because during the 3 months, you change some diet, you change maybe some exercise, because exercise is also a very important part of also weight loss or weight maintaining. But that's basically also a very crucial issue, that you kind of change your lifestyle, and with the change, it takes at least 3 months to adapt it.
Yes.
Yeah, to make it your lifestyle. So that's the reason why I usually always recommend to do the treatment at least 3 months. And then, of course, if you have to lose 50 kilograms, which often happens actually, of course you can't lose 50 kilograms in 3 months. Yeah?
Yeah.
So for those patients, I say, okay, your target is at least 1 year.
Today we learned many things about obesity, and the doctor explained in details everything related to it, including its adverse medical complications and the role of Oriental medicine in the management. Thank you for joining us again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.